How does environmental factors influence public health and healthcare accessibility?
So a couple of environmental factors that happen in Arizona is the air pollution from cities, and then isolation, or being away from the city and having direct access to care.
Do you think that our neighboring cities is like a cause of our air pollution, or is it just like Arizona in general?
I think it's just Phoenix in general. I know that we're in a weird spot because we do get a lot of state winds, which come over from California and Texas and everywhere else. But I think it's mostly just Phoenix.
And what challenges do hospitals in the United States face in providing care to different income groups?
But different income groups can be negatively affected by care, because if they're unconscious or if they receive care that they can't afford, they will still be charged for that care, and the hospital won't really work with them to relieve some of that debt or financial stress. They will just give the care and dump a bill on you.
I think after you leave the hospital, you're no longer a patient, you're just another person there.
Yep.
Okay, what do you think about how other countries like Vietnam handle healthcare? Do you know a background of how Vietnam handles healthcare?
I did some research before this interview, and it is universal, right, in a way. I also did some research on like individualistic societies and collectivist societies, and these handle healthcare very differently. I think it's very interesting how collectivist societies do their healthcare, and I think it's actually built way better because it's built around building our society up as a whole, whereas like individualistic or capitalistic societies are like, oh, we're going to have private healthcare, you have to have insurance, you have to jump through all these hoops to have access to the healthcare that you want. So it is interesting that they are able to offer healthcare through jobs. My roommate doesn't have a job, and she's not on her parents' healthcare, and I know she's been struggling, and she's even afraid to leave the house some days because she's like, if I get hit, like I'm going to be in debt for the rest of my life.
Yeah.
So I think that what other countries like Taiwan and Japan are doing is benefiting the citizens overall because they're trying. So
do you think preventive care like vaccination and checkups is emphasized enough in the US?
yes, I think that vaccination is emphasized enough. I mean, they're giving babies like 15 vaccines as soon as they're like a day old or whatever. So I do think it's emphasized enough. I think it's important to do your own research too, like if you're going to a different country or coming back, because it's all about what you're predisposed to culturally and ethnically. And sometimes like you may need a vaccine more than I need it, like just because of our genetics, which is interesting. So I think there could be more information out there about vaccines, but I do think that we have a healthy vaccine regimen for people. You have mRNA vaccines and microbial vaccines, and they're moving away from microbial vaccines ever since COVID, and I don't know, that's also important to research.
Can you describe the studies and experiences in Vietnam healthcare system versus the healthcare system in America? I know Vietnam's healthcare system is more like a collectivist rather than the United States, which is an individualist.
Yeah, you would be correct. It's more about the Vietnam healthcare system is owned by and operates by the government, so you can say that's like a universal healthcare system, and it's very different from the U.S. highly privatized like healthcare system. My experiences with it, I would say is there's only been like positive experiences because I haven't really been admitted or to a hospital or anything during my time I was living in Vietnam. So I'm really grateful for that. And but my family does have experience with it, and most of the time it's been positive. Positive. They don't run into any real problem at all. At least because we had my family. We had some relatives who works in the industry as well. We got some really good advice from them to go to which doctor you should come and see if you have this condition, and they got connection with hospital that also accelerate the process of admission if there was like an emergency or anything. Just like how my I say like 7 years ago when like my uncle was having his first kid, so my relative was able to call up the hospital, so it got done really quickly compared to the U.S. Healthcare system. Well, from my experiences, I've been looking through social media, through the news. I heard that there's a very complex situation right now. Many hospitals use different models of payment and then insurance plans got interconnected like between the departments. It's not about only healthcare, but like about I'll say it operates more like a business compared to what Vietnam has. It's just basically that you go to a hospital and then they treat you, and payment is not really the main care for most of the time in Vietnam.
Yeah.
Of that, but with like the biggest thing with like Viet people is if they're not feeling unwell, they will not go to a medical checkup because they have like in their mind going to a hospital is a place of like illness and sick and death and stuff, and they're afraid of getting contaminated with a disease while they're in the hospital. They're afraid to get nostrological infection, so they try to avoid going to places like that because it's not like the hospital is a bad place, but bad things happening in the hospitals, but they will try to avoid that. But it's understandable though, because we like their upbringing, like the Gen Y, Gen X, they're like it was a war, and then post-war it was pretty bad too. So nothing was really safe back then. And then Agent Orange was a big problem after the war. You know what Agent Orange is? It's like a pesticide that the U.S. Army used because we were doing guerrilla warfare, right? So they need to kill off the plants. So they would dump like a bunch of these pesticides that
Mhm.
has that's contaminated the water and the plants there.
Oh my God.
And it caused like a mutation with the fetus. So a lot of some that generation, there were really sad cases of like mutation in the fetuses with people born with like syndromes and disability because their parents got contaminated with the pesticide, which is Agent Orange, that the U.S. Army dumped over, I was saying, in the Vietnamese jungle. So that's why they have like I'll say from my opinion, that's why the older generation have a more careful approach to hygiene and stuff.
That's very understandable. I would. Registered RMA medical assistant. I basically triage patients. I take their blood pressure, give them injections, take care of wound care. Um, yeah, basically like flu test, COVID test, strep test, stuff like that. There's some patients who don't have healthcare. They're a little upset that our self-pay prices are a little bit higher than other urgent cares. We do start at $310 for a self-pay visit, but we do offer medical discount programs that lower the price to $190. How many medical discount programs do you have? What kind of is there? We just have two of them. One of them is a yearly plan and the other one is a monthly plan. Okay. I see patients reaching for the yearly plan just because it's more convenient and they don't have to come in the office. So based on your experience, how does Iraq's healthcare compare to the United States? It's a lot more accessible, but I would say it's more quality over quantity here and quantity over quality there. Mm-hmm. Iraq is a an oil-based country, so basically healthcare is free. And a lot of doctors, they have the opportunity to open up their own clinics, which makes it a lot more accessible for patients to go here and there. But if they go through a public hospital, they're taken care of for free, and they don't have to worry about the bills. Okay. Versus here, where patients refuse to take ambulances because a single ambulance ride costs about like $400. I think it's above that. Mm-hmm. Sure. I think it's like over. Yeah, I think I had a patient. He was like, "Don't call him. Don't call him. Please don't call it." And he's like passed out on the floor. I know. Think Iraq's healthcare system shares any similarities with Vietnam? Why or why not? I feel like so. They both have universal healthcare, so it's accessible to a lot of their citizens. I feel like since they are migrating out, Vietnam is migrating out a little bit. That might lessen the accessibility to their citizens for healthcare, and that might not make them inclined to go drive further up into the city. While Iraq, there's a whole city for medical offices. So.